My name is Dr. David Heward. I'm an optometrist in South Portland, Maine, and I have a machine over here called the GDX, which is about 3 years old, which is an early diagnostic machine for checking out for patients with glaucoma. We have a newer machine right here called the Optical, which is called an OCT. We use this to check patients with macular degeneration or diabetes and glaucoma. We found a patient this morning who has some macular edema and without treatment could possibly go blind. So this is some of the early diagnostic equipment we have for checking patients in early stages of different diseases. This is a high-tech one called frequency doubling technology by Humphrey, and it checks your peripheral vision in about 30 seconds. And this is our fundus camera that takes a picture of the inside of the eye, which is older technology, but we basically take a picture of everybody's eye and do a peripheral visual field in every patient at least once a year in this room here. This is a microscope to look at someone's eye very, very carefully. This is just the old-fashioned machine for which lens looks better, one or two. By the time I have my patients in this room, pretty much most of the exam is done. A better healthcare system, more choice, where the patients would be allowed to have their private insurance or a government insurance, but the patient could come to the appropriate office and have proper health care. We see a lot of patients in our office, and sometimes we see them, I think, a little bit too late. I had actually a patient whose last exam was in 1977. She came to my office a year ago, and she is now blind from glaucoma. She didn't know she had glaucoma, and unfortunately she did not have health insurance. She had health insurance through Medicare. She didn't know it was available to her. She went blind. So I think patients need to be educated better that they do have health insurance. Every American should have the ability to have proper health care in this country. I think we're spending way too much money for a healthcare system that's not working very, very well. I think whether you're the richest person or the poorest person in the country, I think you should treat every person. The doctor should look at the patient and say, this is the first patient I've ever seen, this is the last patient I've ever seen, this is the only patient I will ever see. And if you treat people like that as if they were your friend or your relative, I think healthcare could be much more efficient. I think it's very unfortunate when people don't know they have coverage, or they go to the emergency room when they should be seen by their general practitioners. And I think if we had a better healthcare delivery system, which needs to be more efficient, better run, and I know the government can do a better job than the private insurance companies out there today.